Young doctor changed bandage for female millionaire in a coma shockingly. She woke up and... How could a simple bandage change lead a young doctor to suspect a millionaire patient isn't just in a coma, but being held captive by a sinister plot? He digs for the truth, risking his career, but the truly shocking twist lies hidden in a secret test and the desperate measures taken to keep her silent. Subscribe, like, and listen now to hear the full, suspenseful story. The sterile white gauze felt unnervingly damp beneath Dr. Noah Bennett's gloved fingers. Not saturated, not alarming in a critical sense, but wrong. He peeled back the dressing on Sophia Hayes's forearm, near the fore-insertion site, revealing skin that was faintly pink, slightly puffy. The chart, meticulously updated hourly by Nurse Greg, read, "Site clean, dry, intact. No signs of inflammation." A blatant lie. Noah frowned, his resident's exhaustion momentarily forgotten, replaced by a prickle of unease. 3 months she'd been here, on the VIP floor of Chicago's Lakeshore Prestige Hospital. Sophia Hayes, the tech billionaire, the enigma in room 12, locked in a persistent vegetative state since a devastating car crash. Comfort measures only, per family directive her brother, Victor Hayes, the acting CEO of Hayes Innovations. Minimal intervention. That included dressing changes, apparently only when strictly necessary, and always handled by Greg, Victor's preferred nurse. But Greg had called in sick tonight, an unusual occurrence, leaving the floor slightly short-staffed. Noah, covering, had decided to do his own checks. This inflammation, though minor now, could become cellulitis, even sepsis if ignored. Against the implicit do not disturb aura surrounding the patient, he gathered supplies. Cleaning the site with practiced efficiency, applying a thin layer of antibiotic ointment, he felt it again, that sense of wrongness. It wasn't just the skin. Her vitals, displayed on the monitor above the bed, flickered almost imperceptibly. A slight dip in oxygen saturation, a fractional increase in heart rate as he worked, more than the usual unconscious response to stimulus. He glanced at the fore-pump, tracing the lines. Standard saline drip, low volume. But something near the secondary medication port caught his eye, a faint, almost invisible residue, slightly oily, near the connection point. And was that a scent? Faintly chemical, masked by antiseptic? He leaned closer, his medical instincts humming, overriding the hospital hierarchy that screamed, "Leave the VIP alone." This wasn't the profile of a stable coma patient. This felt suppressed, managed. Suddenly, the rhythmic beep of the monitor changed pitch slightly. Her eyelids fluttered a tremor so slight he might have imagined it. He held his breath, watching her face, pale and still beneath the soft glow of the monitor. Nothing more, but it was enough. Doubt crystallized into sharp suspicion. This woman wasn't just unresponsive. Something was actively keeping her that way. The soft swish of the corridor door opening made him jolt. He quickly secured the new, clean bandage, pulling the blanket higher over her arm. Head nurse Collins stood in the doorway, her expression mildly questioning. "Dr. Bennett, everything all right? I thought Mr. Hayes preferred minimal interaction." Noah forced a calm he didn't feel. "Just ensuring patient comfort," Nurse Collins noticed some potential irritation near the foresight. He kept his voice neutral, professional, but his mind was racing. What had he stumbled upon? And who would want to keep Sophia Hayes silent? Dr. Noah Bennett lived by the clock and the pager. At 28, he was navigating the notoriously grueling third year of his internal medicine residency at Lakeshore Prestige Hospital, a gleaming tower overlooking Lake Michigan that catered to Chicago's elite. Life was a blur of 80-hour weeks, sleep deprivation, Endless rounds, complex diagnoses, and the constant pressure to perform under the watchful eyes of senior attendings. He'd chosen medicine out of a genuine desire to heal, a slightly idealistic notion forged during his childhood, watching his own mother, a community nurse, care for their neighbors in a working-class suburb far removed from Lakeshore's opulence. Noah possessed a sharp analytical mind, a quiet observational skill honed by hours spent deciphering patient histories and lab results, and a deep-seated ethical compass. He wasn't a rebel by nature. He understood hierarchy and protocol. But his defining trait was meticulousness. He didn't cut corners, even when exhausted. His flaw, perhaps, was a tendency toward stubbornness when he believed he was right, sometimes making him seem aloof or challenging to overworked colleagues. His primary relationship was with his work, though he maintained a close phone connection with his sister, Sarah, a pragmatic public defender who often worried about him burning out. Lakeshore Prestige ran on money, reputation, and influence as much as on medicine. The staff navigated a complex ecosystem of demanding patients, high expectations, and internal politics. VIPs like Sophia Hayes occupied entire wings, their care dictated by family members who were often major hospital donors. Questioning a care plan set by such influential figures was generally discouraged, especially for residents low on the totem pole. Noah had learned quickly to tread carefully, focusing on the science, the evidence, and keeping his head down. Sophia Hayes was a legend even before her accident. The brilliant, enigmatic founder of Hayes Innovations, a multi-billion-dollar tech firm headquartered downtown. She was known for her visionary ideas and intensely private life. The car crash 3 months prior had been front-page news, a single-vehicle accident on a rain-slicked Lakeshore Drive. No witnesses, leaving her with severe head trauma and unresponsive. Her older brother, Victor Hayes, had stepped in immediately as interim CEO and primary decision-maker regarding her care. Affable in public, known for his polished corporate demeanor, Victor projected an image of devoted concern. He visited the hospital regularly, conferring quietly with the chief of staff and ensuring Sophia received the best, most respectful care, which translated to minimal intervention and a quiet maintenance of the status quo. He'd handpicked Nurse Greg Davies, an experienced but somewhat mercenary agency nurse, for her primary care team, citing his comfort with Greg's approach. Rumors occasionally surfaced in a hospital gossip mill, whispers about tensions between Sophia and Victor before the accident, disagreements over the company's direction, Sophia's alleged plans for major philanthropic initiatives that Victor opposed. But these were just whispers, easily dismissed amidst the daily emergencies and demands of hospital life. Noah's world was one of controlled chaos, evidence-based practice, and clear protocols. He found comfort in the logic of medicine, the diagnostic process, the satisfaction of solving a complex case. The ambiguity surrounding Sophia Hayes, the disconnect between the chart and the reality, the subtle signs he'd observed, these things grated against his innate need for order and truth. He wanted to believe the best, to trust the system, but the faint chemical scent near the foreport, the tremor of an eyelid, the falsified nursing notes, they hinted at a darkness lurking beneath the polished surface of Lakeshore Prestige, a deliberate manipulation hidden within the very sanctuary meant for healing. The world he knew, governed by science and ethics, felt increasingly threatened by secrets and lies surrounding the woman in room 12. The inciting incident wasn't a single dramatic event, but Noah's deliberate choice to act on his unease, crossing an invisible line drawn by hospital politics and family influence. It began with Nurse Greg Davies' unexpected absence. Greg, usually reliably present for his shifts covering Sophia Hayes, called in sick citing a migraine. This deviation from routine fell on Noah's rotation, covering the VIP floor, a duty usually handled by more senior residents or fellows, but staff shortages were endemic. Before starting rounds, Noah reviewed Sophia's electronic chart. Page after page detailed stability, vitals steady within narrow parameters, neurological checks consistently showing no change from her baseline Glasgow Coma Scale score. For sight clean, dry, intact, charted religiously by Greg at the start and end of every shift he worked. Yet something fell off. The sheer lack of change over 3 months was statistically possible, but coupled with the family's insistence on minimal neurological reassessment beyond the basics, it struck Noah as passively incurious. His standard patient checks brought him to room 12. The spacious suite was dimly lit, quiet except for the rhythmic sighs of the ventilator and the soft beeps of monitors. He performed the routine checks, pupils fixed, no response to basic stimuli. Standard. But then he focused on the foresight on her left forearm, the one Greg's notes always described so perfectly. Through the transparent dressing, Noah could see the faint pinkness he'd later confirm up close. It wasn't dramatic, but it wasn't clean, dry, intact either. A small internal debate ensued. Protocol for a VIP patient under specific family directives. Comfort care, interpreted by administration as minimal deviation from baseline and less critical, suggested merely documenting the observation. Escalating it might require waking a senior attending, notifying the family liaison, potentially triggering bureaucratic blowback for something minor. It was easier, safer, to just note it and move on. Greg will be back tomorrow. But Noah's training, his core ethics, wouldn't let it go. A potential infection source, however minor, needed addressing. He made the decision. He would change the dressing himself, properly clean the site, apply preventative ointment. It was basic nursing care, technically within his purview as a covering physician, yet it felt like a transgression against the unspoken rules surrounding Sophia Hayes. As he meticulously performed the dressing change, the moment described in the hook, his senses went on high alert. The dampness of the old gauze, the slight puffiness, the flicker in her vitals, the oily residue near the port, the faint chemical scent. These weren't isolated data points. They formed a disturbing pattern. He thought back to the pharmacology lectures, the toxicology rotations. What could cause persistent sedation, mimicking a coma state, potentially administered subtly via and for? Long-acting benzodiazepines? Barbiturates? An anesthetic infusion carefully titrated? His initial reaction was a jolt of adrenaline mixed with professional disbelief. Could someone be deliberately sedating her? Here? At Lakeshore Prestige? The idea seemed preposterous, paranoid. Yet, the evidence, however subtle, pointed that way. He quickly finished, disposed of the old dressing materials, careful not to leave traces of his intervention beyond a fresh bandage. When Nurse Collins appeared, Noah masked his turmoil. He needed time to think, to investigate discreetly. His immediate goal formed, not to sound a premature alarm, but to gather concrete proof. He needed to understand what was happening to Sophia Hayes and why Greg's charting was so inaccurate. Was Greg negligent or complicit? Was a residue near the foreport significant? He needed access to pharmacy records, toxicology screens, maybe even security logs. Fear mingled with determination. He potentially uncovered something dangerous, something powerful people might want hidden. His tentative first step would be a deep dive into Sophia's medication administration records, looking for anomalies Greg's routine charting might have missed. He had to tread carefully. A single misstep could end his career or worse. Noah's investigation began under the cloak of routine work. He couldn't directly accuse anyone or demand restricted files without concrete evidence, especially concerning the Hayes case. His first move was to meticulously cross-reference Sophia Hayes's medication administration record, MAR, with the pharmacy dispensing logs for the VIP floor. Accessing detailed pharmacy logs required specific privileges, but basic dispensing times and drug types were often available within the integrated electronic health record system he used daily. He spent hours during his infrequent downtime, often late at night in the deserted residence lounge, comparing timestamps. He noticed a pattern: small-dose sedative orders, primarily lorazepam, charted by Greg Davies more frequently than typical for long-term stable ventilator management. Furthermore, the pharmacy dispensing logs sometimes showed withdrawals of sedatives or even low-dose anesthetic agents like propofol under Greg's credentials that didn't perfectly align with the MAR entries for Sophia or other patients Greg occasionally covered on the floor. The discrepancies weren't glaring, easily explained away as charting delays or waste documentation, but they formed a consistent, nagging anomaly. Noah decided to observe Greg more closely. He rearranged his schedule subtly, swapping call nights, volunteering for extra checks on the VIP floor when Greg was on duty, citing diligent patient monitoring. He witnessed Greg's interactions, efficient, professional, yet oddly detached when dealing with Sophia directly. He saw Greg have hushed conversations on his cell phone in the corridor, often looking tense afterward. He also observed Victor Hayes during his visits. The polished grief seemed less convincing up close. Victor spent more time on his tablet, presumably handling Hayes Innovations business, than interacting with his sister, though he always made a point of thanking Greg effusively. Noah needed more than logs. He needed biological proof. Standard hospital policy for coma patients didn't typically include frequent, random toxicology screens unless there was a specific clinical indication. Noah couldn't order one without raising red flags. He considered collecting a discarded 4-tubing set after Greg's shift for analysis, but dismissed it as too risky. Tampering with biohazardous waste could get him fired instantly. He tried confiding, cautiously, in Dr. Lena Petrova, a senior attending neurologist known for her sharp mind and quiet integrity. He presented his findings as concerns about potential medication mismanagement impacting Sophia's neurological baseline. Dr. Petrova listened intently, reviewed the logs Noah had flagged, and acknowledged the discrepancies were curious. However, she warned him starkly, "Noah, tread carefully. Victor Hayes is deeply embedded with the hospital board. Accusations, even veiled ones, against his chosen nurse without irrefutable proof could be career suicide. Document everything, be certain, but do not act rashly." Her cautious validation was small comfort, highlighting the institutional resistance he faced. The complications mounted. Greg, perhaps sensing Noah's scrutiny, became more guarded. On one occasion, Noah found a critical patient monitor he was responsible for had been inexplicably silenced. An alarm that should have sounded didn't. While impossible to prove, Noah suspected Greg's interference, a subtle warning. Separately, a minor charting error Noah made weeks ago, initially overlooked, was suddenly flagged and escalated to his residency program director by an anonymous complaint, another likely shot across the bow. Victor Hayes also seemed to increase his presence, making pointed remarks to Nurse Collins about ensuring only authorized personnel interacted closely with Sophia and reiterating his satisfaction with Greg's attentive care. The pressure was building. Noah felt increasingly isolated, his suspicions solidifying, but his concrete proof still circumstantial. Amidst this, Sophia began showing fleeting, inconsistent signs of responsiveness, but only when Noah was present and Greg was off shift or occupied elsewhere. A brief tightening of her hand around his during a reflex check, a momentary tracking motion with her eyes when he moved across her field of vision. These were subtle, easily missed or dismissed as random neurological noise, but Noah documented them meticulously, time-stamped. They fueled his conviction. Sophia was in there, fighting against whatever was suppressing her, and he was running out of time before whoever was doing this realized she was close to surfacing. The stakes were no longer just about uncovering a medical mystery. They were about saving a life from a hidden, ongoing assault. The turning point arrived not with a dramatic confrontation, but through a calculated risk and a stroke of luck. Noah knew he needed definitive proof, something linking the anomalous sedative logs directly to Sophia's suppressed state. He theorized that if Sophia was being deliberately oversedated, her system might not metabolize the drugs as efficiently as expected, potentially leading to detectable levels even hours after administration, especially if doses were being given off-log. Standard hospital tox screens weren't sensitive enough or targeted for the specific agents he suspected in the low doses likely being used. He needed a research-grade toxicology analysis. His sister, Sarah, the public defender, proved unexpectedly helpful. Through her network, she connected Noah with a contact at a university research lab, Dr. Chun, who specialized in forensic toxicology. Getting a sample out of the hospital undetected was the major hurdle. Noah formulated a plan centered around a necessary procedure: replacing Sophia's central venous catheter, a task requiring sterile technique and, crucially, the drawing and discarding of blood waste from the line before flushing. This was a standard procedure, less likely to draw scrutiny than an unscheduled blood draw for unspecified tests. He managed to schedule the line change during a shift when Greg was off duty and Victor Hayes wasn't expected. Dr. Petrova, aware of Noah's ongoing concerns, though not the specifics of his plan, agreed to supervise, providing necessary oversight. During the procedure, Noah meticulously followed protocol. When drawing the mandatory blood waste before flushing the new line, he subtly diverted a small portion, just a few milliliters, into a pre-labeled vacutainer tube he'd palmed, using a technique often employed for collecting simultaneous samples for different tests. He slipped the tube into a biohazard bag containing the discarded old catheter and other waste materials. Later, during his break, he retrieved the specific bag from the temporary holding area, a calculated risk, relying on the sheer volume of hospital waste and lax oversight in that specific zone. Extracted the tube, packaged it carefully according to Dr. Chen's instructions, and arranged for Sarah to courier it discreetly to the university lab, marked as an anonymized research sample. The wait for the results was agonizing. Noah continued his shifts, maintaining a facade of normalcy, acutely aware of the ethical lines he'd crossed and the potential consequences. He avoided Greg, limited interactions with Victor, and focused on his other patients, documenting everything related to Sophia with obsessive care. 2 days later, Sarah called. Dr. Chen's preliminary results were back. The anonymized blood sample contained trace, but definitively identifiable, metabolites of propofol and a longer-acting benzodiazepine, clonazepam. Crucially, the levels, while low, were inconsistent with the infrequent low-dose sedative orders documented in Sophia's MAR for agitation management. Furthermore, the specific metabolite profile suggested more recent and sustained administration than the official record indicated. It wasn't just mismanagement. It was active, unrecorded sedation. This was it, the objective proof. Noah felt a surge of validation mixed with cold dread. He now knew, unequivocally, that Sophia Hayes was being chemically imprisoned. His suspicions were real, The danger was real, and the conspiracy likely involved Greg acting under instructions. The goal instantly shifted from investigation to intervention. He had to expose this, protect Sophia, and stop the sedation before permanent damage occurred, or she was silenced for good. He realized he couldn't rely on internal hospital channels anymore. The risk of cover-up orchestrated by Victor Hayes was too high. He had to go outside. This was the point of no return. He had crossed the Rubicon, and the consequences, for better or worse, were unavoidable. His next step: strategize with Sarah and Dr. Petrova on how to present this explosive evidence to the authorities without compromising Sophia's immediate safety. The toxicology report changed the equation entirely. Noah met secretly with Sarah and Dr. Petrova off hospital grounds. Sarah, accustomed to navigating treacherous legal waters, immediately recognized the gravity and the danger. "This isn't just medical malpractice, Noah," she stated grimly. "This is potentially attempted murder, conspiracy, major fraud if Victor's using his control of the company improperly. We need to move carefully, but quickly." Dr. Petrova, initially cautious, was now fully convinced and visibly angered by the betrayal of medical ethics. "The hospital administration needs to be bypassed initially," she advised. "Victor Hayes has too much influence. Reporting this internally might just tip him off and endanger Sophia further. We need to bring in law enforcement, but discreetly." Their strategy coalesced. Sarah would leverage her contacts to arrange a confidential meeting with a trusted detective in the Chicago PD's Financial Crimes and Public Corruption Unit, presenting the case as potential high-stakes fraud with medical endangerment, rather than leading with the attempted murder angle, which might require more immediate, overt action that could alert Victor. Dr. Petrova would act as a credible medical expert, explaining the significance of the toxicology findings and the suspicious charting patterns. Noah's role was to continue documenting anything unusual at the hospital while trying to appear non-threatening, essentially acting as bait or simply an observer, feeding information to Sarah. The immediate fallout of Noah's intensified focus, however, wasn't lost on Greg Davies. The nurse became visibly more anxious, his interactions with Noah clipped and hostile. He started double-checking Noah's work, looking for errors, likely under pressure from Victor. Noah felt the net tightening. He knew Victor and Greg must suspect something, even if they didn't know about the toxicology report. Noah's internal conflict intensified. He was operating far outside the normal bounds of his residency, risking everything. Doubts gnawed at him. Was the evidence strong enough? Would the police act fast enough? What if Victor retaliated before they could intervene? He found himself struggling to focus on his other patients, the stress manifesting as headaches and insomnia. Sarah secured the meeting with Detective Miller, a seasoned investigator known for handling complex white-collar cases. Miller listened patiently as Noah laid out the timeline. Dr. Petrova explained the medical science, and Sarah highlighted the potential financial motives related to control of Hayes Innovations. The toxicology report was the centerpiece. Miller was intrigued but cautious, emphasizing the need for corroborating evidence linking Victor Hayes directly to instructing Greg. He agreed to open a preliminary, confidential inquiry, focusing initially on financial irregularities at Hayes Innovations under Victor's interim leadership and Greg's background. Meanwhile, at the hospital, Noah noticed a subtle shift in Sophia's care plan, initiated by Victor. Increased baseline sedation orders for patient comfort and ventilator synchrony, making it harder to distinguish deliberate suppression from prescribed medication. It felt like a preemptive move, an attempt to muddy the waters if questions were asked. Sophia herself remained the silent battleground. During brief windows when Greg was occupied, Noah continued his quiet attempts at neurological stimulation. He spoke to her, played soft music from his phone, a classical piece he'd read she favored, and performed passive range-of-motion exercises. On one occasion, he was certain her fingers weakly curled around his in response to his voice. He documented it, along with a corresponding transient spike on the EEG monitor that was quickly dismissed by the official neuromonitoring tech, likely influenced by the prevailing no-change narrative as artifact. These fleeting signs were heartbreaking fuel, solidifying Noah's resolve. He wasn't just fighting a conspiracy. He was fighting for the person trapped inside. His strategy now involved not just exposing Victor and Greg, but creating windows of opportunity for Sophia to demonstrate awareness, hoping to strengthen their case before Victor could silence her permanently or discredit Noah completely. Detective Miller's preliminary investigation began yielding results, confirming Sarah's suspicions about Victor Hayes' motives. Financial records subpoenaed from Hayes Innovations revealed Victor had been systematically leveraging company assets for high-risk personal investments, draining resources, and consolidating control in ways Sophia likely would never have approved. He had also recently initiated proceedings to have Sophia declared legally incapacitated, a move that would grant him permanent control over her fortune and the company. The timeline showed these activities began almost immediately after Sophia's accident. Miller now had a powerful motive. Simultaneously, Miller's background check on Nurse Greg Davies revealed a history of financial trouble, including significant gambling debts. Greg was vulnerable, making him a prime target for bribery or coercion. The pieces were falling into place, but Miller still needed a direct link proof that Victor was instructing Greg to maintain the sedation. Victor, likely sensing the net closing or perhaps alerted by contacts within the city bureaucracy, became increasingly erratic. His visits to the hospital grew more frequent, his demeanor more controlling. He installed private security outside Sophia's suite, limiting access further and pointedly excluding Noah whenever possible. He also escalated his efforts to discredit Noah, lodging a formal complaint with the hospital board alleging Noah was unstable, obsessed with Sophia, and harassing the family. This triggered a formal internal review, placing Noah under immense pressure. His residency director advised him to take a leave of absence, effectively suspending him from clinical duties pending the review's outcome. This was Victor's goal: remove Noah from the equation, cutting off his access to Sophia and any further evidence gathering. It was Noah's dark night of the soul. Suspended, potentially facing the end of his career, locked out of the hospital, he felt powerless. He worried desperately about Sophia. Without his vigilance, what might Victor and Greg do? Would they increase the sedation permanently? Stage another accident? He met again with Sarah and Dr. Petrova. Despair warred with determination. Going public with the current evidence felt premature. Victor's lawyers could easily spin it, bury them in litigation. They needed something undeniable connecting Victor directly to Greg's actions. Their break came from an unlikely source: hospital IT. The tech who had initially helped Noah navigate the pharmacy logs, sympathetic to Noah's quiet persistence and wary of Greg's demeanor, had continued monitoring network activity related to the VIP floor out of curiosity. He discovered Greg had been using a hospital-issued tablet, supposedly for charting, to communicate with Victor via an encrypted messaging app, a violation of hospital policy. While the messages themselves were encrypted, the connection logs showed frequent communication between Greg's device and a specific IP address traced back to Victor Hayes' personal network, particularly often just before or after sedative discrepancies Noah had previously flagged. It wasn't the content, but the pattern was damningly suspicious. Armed with this new digital breadcrumb trail and the mounting financial evidence, Detective Miller felt he had enough to press Greg Davies. He planned to bring Greg in for questioning, leveraging his financial vulnerability and the threat of conspiracy charges, hoping to make him flip on Victor. The final test for Noah was trust. He had to trust Miller's plan, trust Sarah's legal guidance, trust Dr. Petrova's support, and trust that the system, however flawed, would ultimately pursue justice. He also had to prepare for the possibility that Greg wouldn't flip or that Victor would find a way to silence him. Noah provided Miller with detailed notes on Greg's routines, habits, and likely psychological pressure points. He then waited, suspended and anxious, for the final confrontation to unfold, hoping his actions hadn't inadvertently pushed Victor into a corner from which he might lash out lethally against Sophia. Detective Miller's team moved quickly but quietly. They picked up Greg Davies as he left his apartment building before his hospital shift. Faced with Miller's calm presentation of the evidence, the financial motive, the gambling debts, the pharmacy log discrepancies, the toxicology report from Sophia's blood, and crucially, the communication logs linking his hospital tablet directly to Victor Hayes' network during suspicious times, Greg crumbled. The veneer of professional composure dissolved into panicked self-preservation. He confessed everything. Victor Hayes had approached him shortly after Sophia's admission, appealing to his financial desperation. Victor supplied him with vials of concentrated sedatives and anesthetics, instructing him on how to administer them discreetly through the secondary foreport or by subtly adjusting the infusion pump settings, always off the official record. The goal was simple: keep Sophia stable but unresponsive, preventing any chance of recovery or communication while Victor consolidated his control over the company and her assets. Greg provided details of the payment methods, cash deposits into obscure accounts, and confirmed the encrypted messages contained specific instructions. He agreed to cooperate fully in exchange for potential leniency. Armed with Greg's detailed confession and cooperation, Miller obtained an immediate arrest warrant for Victor Hayes and a search warrant for his home and office. Simultaneously, Miller dispatched a uniformed team with Dr. Petrova and Hospital Security Administration, now fully briefed and cooperating, to secure Sophia's room and ensure her safety. They arrived to find Victor in the room, arguing heatedly with a nurse who was questioning a new medication order Victor insisted was necessary. The sudden arrival of police and hospital brass stopped him cold. As Detective Miller informed him he was under arrest for conspiracy, attempted murder, and fraud, Victor's composure finally shattered, revealing the desperate man beneath the polished facade. He lunged, not in attack, but toward Sophia's bedside monitors, perhaps attempting to disrupt them or silence alarms. But security swiftly restrained him. Sophia, undisturbed by the commotion, remained stable, now finally safe from his influence. The conspiracy, woven in whispers and hidden actions, unraveled under the weight of evidence and betrayal. The aftermath was swift and decisive. Victor Hayes, facing Greg's testimony, the financial evidence, the digital trail, and potentially damning evidence recovered from his devices, accepted a plea deal rather than face a lengthy public trial. He was sentenced to a significant prison term for conspiracy, fraud, and assault related to the unlawful sedation. Greg Davies received a lighter sentence due to his cooperation, but lost his nursing license permanently. Lakeshore Prestige Hospital faced intense public scrutiny and several lawsuits. They implemented sweeping reforms in patient safety protocols, VIP care oversight, and medication management systems. Noah Bennett was fully exonerated by the internal review, his actions lauded. He was offered reinstatement, but after his ordeal, he chose to complete his residency at a different Chicago hospital, seeking a fresh start. Sophia Hayes began the long road to recovery. Freed from the constant sedation, she slowly emerged from the chemically induced coma over several weeks, aided by intensive neurorehabilitation and Dr. Petrova's dedicated care. Her mind was sharp, though her body required months of therapy. Noah visited her regularly, initially as a concerned former physician, then as a friend. They bonded over their shared trauma, Sophia's quiet determination, and Noah's steadfast support. There was an undeniable connection, forged in extraordinary circumstances, but they allowed it to develop naturally, without pressure. Sophia, demonstrating remarkable resilience, retook control of Hayes' innovations. She initiated a major corporate restructuring, prioritizing ethical practices and establishing significant philanthropic arms focused on medical research and patient advocacy, inspired partly by her own experience and Noah's integrity. She offered Noah a consulting role with her company's new health tech division, which he accepted part-time after completing his residency, excited by the chance to impact healthcare on a larger scale. Their relationship deepened over the following year. There was no dramatic proposal, but a quiet understanding grew between them. The story ends not with a wedding, but with Noah and Sophia attending the launch of a new patient advocacy center funded by the Hayes Foundation. They stand together, watching patients access resources they wouldn't have had otherwise. Sophia touches Noah's arm, a simple gesture conveying deep gratitude and affection. "You didn't just change my bandages, Noah," she says softly. "You gave me back my life, my voice." Noah meets her gaze, a warmth spreading through him that has nothing to do with medical charts or diagnoses. "And you," he replies, "showed me what truly matters." Their future wasn't defined by the darkness they'd overcome, but by the light they were building together, grounded in hard-won trust and shared purpose.